Today, I want to delve into attention deficit hyperactivity disorder, or ADHD, a condition often misunderstood despite its long history in medical literature. While recognized by some physicians as far back as 1902, the understanding of ADHD has evolved significantly. Initially, from 1902 until 1980, it was predominantly viewed as a behavioral issue in young boys, an inability to sit still or remain quiet. However, a pivotal shift occurred in 1980 when attention deficit was formally incorporated into the disorder's name. This marked a growing realization that ADHD is less about overt behavior problems and far more a challenge with the brain's executive functions, its management system. It's crucial to dispel a common misconception from the outset. ADHD has absolutely no correlation with intelligence. I've worked with individuals across the entire intellectual spectrum, from university professors, doctors, and lawyers to individuals in various other professions and those who find basic tasks challenging, all of whom have ADHD. Intelligence is not a protective factor, nor is a lack of it a cause. A primary complaint is difficulty sustaining attention. Individuals often describe it as their focus drifting. They might grasp part of a lecture, reading material or task, only to find their mind wandering, then returning, then drifting off again. It's akin to a poor cell phone reception where the signal fades in and out. Another hallmark is distractibility. While everyone experiences distractions, those with ADHD find it exceptionally hard to filter them out when focus is required. A dropped pencil in a classroom, a fleeting thought about a TV show, a past conversation, these can all derail concentration. It's like trying to watch television with multiple channels superimposed on one another, making it incredibly difficult to separate the signal from the noise. The puzzling aspect, however, is that this isn't a constant state. Almost universally, individuals with ADHD have specific activities where they can focus effortlessly. For example, a 16-year-old star ice hockey goalie I saw was described by his parents as missing nothing on the ice, displaying phenomenal focus during a fast-paced game. Yet, in the classroom, despite high intelligence and a desire to succeed, he was perceived as inattentive. When asked about this discrepancy, individuals with ADHD often state, "It's easy if I'm interested. If not, I can't." While this is true for everyone to some extent, the difference lies in volitional control. Those without ADHD can typically make themselves pay attention to immertant, albeit boring, tasks. For those with ADHD, this is incredibly difficult unless the task is intrinsically captivating or there's an immediate, high-stakes consequence, a gun to their head scenario. Under these two conditions, high interest or high pressure, focus can be sharp. Otherwise, it's a significant struggle. This isn't a matter of willpower. It's a difference in brain wiring. Other common challenges include difficulty with organization and task initiation. This can manifest as a disorganized backpack, desk, or living space, or, for others, difficulty organizing their time and prioritizing tasks. Many also struggle with regulating sleep and alertness, often staying up late because they can't shut off their thoughts, leading to difficulty waking and maintaining daytime alertness, especially during sedentary activities. Sustaining effort to complete tasks in a reasonable time frame is another hurdle. Tasks might be started well but then abandoned or rushed. Writing, specifically translating ideas into coherent sentences and paragraphs, can also be a significant challenge due to difficulties in organizing thoughts. Furthermore, while not an official diagnostic criterion, many with ADHD experience difficulty managing emotions. This can present as heightened frustration over minor annoyances, an inability to let go of perceived slights, or an urgent, almost compulsive need to act on a desire. Working memory, the ability to hold information in mind while performing other tasks, is also frequently impaired. This isn't an issue with long-term storage, but rather with the short-term, active mental workspace. The underlying neurobiology of ADHD is thought to involve the brain's chemical messaging system. Our brains contain billions of neurons that communicate via electrical impulses and chemical neurotransmitters across tiny gaps called synapses. Key neurotransmitters, particularly dopamine and norepinephrine, are crucial for the functions impaired in ADHD. The prevailing theory is that in ADHD, while the brain produces these chemicals, their release and reuptake at the synapse are less effective. Pharmacological treatments for ADHD, such as stimulants, aim to improve the efficiency of this neurotransmitter system. For a significant majority, about 8 out of 10, the right medication at the right dose can lead to substantial improvements. However, it's vital to understand that these medications do not cure ADHD. Like eyeglasses for vision, they help manage symptoms while active. Moreover, medication is just one component of a comprehensive treatment plan, which should also include learning skills, utilizing strategies and technology, and fostering a supportive environment involving family, educators, and clinicians. A thorough evaluation is the first step to understanding an individual's specific challenges and strengths. This allows for a tailored plan that builds on those strengths and addresses difficulties, ultimately empowering individuals with ADHD to reach their full potential.